What's up, guys? This is Mike Parker at the Center for OCD and Anxiety in Pittsburgh, PA, and this is OCD Space, where we're talking about all things OCD. Today, going to cover a hot topic, false memory OCD, sometimes some overlap with something called real event OCD, and this is where you are just tortured about the past, wondering, did I do something horrible? Did I hurt someone in some way? Are there people out there that are just so mad at me and so traumatized by me and I don't even realize it? You might be searching your memory for any bad things you might have done that you don't remember. You might be walking out of stores and asking yourself, did I steal something while I was in that store? You might be worrying that you're going to harm yourself at some point and wondering, did I go into the bathroom and swallow a bunch of pills? Once the OCD gets into false memory territory, you can become convinced and worried about all kinds of things. And we're going to talk about that today and throw out a few tips for you guys. So guys, if you've been enjoying these videos, please be sure to subscribe. And if you like this video, hit that like button as well. With that out of the way, let's get started. Alright guys, let's get into it. False memory OCD. This can be a really tricky, sticky kind of obsession, and it just feels like there's no way out because you're stuck in your memory trying to figure out, what could be real, what is something you're imagining, and it just feels like you're stuck and you can't get out of it. And we're going to talk about some tips. Particularly today, I want to throw out some tips from the I-CBT treatment, Inference-Based approach. You may be someone who is doing exposure therapy, and you might be doing some ACT therapy with acceptance, accepting that I can't ever retrieve perfect memories, things like that. But if you're still feeling just very disturbed, very bothered, some of these tips from the inference-based approach might help you get a little deeper into a little bit more of a core issue you might be struggling with, and we're going to review some of those things today. Now, first of all, it's important to recognize that with OCD, when we're looking at things from an inference-based approach, we are talking about the phenomenon of obsessional doubt. And so it doesn't matter the obsession, false memory, just like other forms of OCD, you are obsessionally doubting. And so you may realize, look around your environment and realize there's not a lot of evidence that you have anything that you need to be particularly worried about right now. So, for example, the FBI is not batting down your door right now with a subpoena and a search warrant because you've done something awful, and they've been gathering the evidence against you, and they're finally going to do something about it and arrest you. There are not accusers coming forward and saying you've done this awful thing and I'm here to finally get justice. There's not evidence that you've stolen something or done something horrible, but you're worried that there's something you don't know, and that's the nature of false memory OCD. I don't trust this quiet. I don't trust this safety. I don't trust this lack of anything happening. I don't trust this lack of information. I feel like I did something wrong, and I feel like I have to make sure that I know for certain if I did or didn't, and I'm going to have to go into my memory to do that. And so this is all stemming from a lack of trust in your environment, in the information you have available, in your senses, and ultimately a lack of trust in yourself. Now, what we want to do, guys, is reactivate trust for you. We want to get you back to a place of trusting the information you have available. This lack of information, right? This lack of accusers, this lack of any police calling, that is actual information to be trusted. This means there is actually nothing indicating you have to search your memories and figure out what you did wrong. So let's look at some of the reasons why you might be convinced that you should doubt yourself, and let's see if we can start to chip away at some of these reasons, because usually OCD reasons are tricks. OCD reasons are usually convincing, but ultimately when you really assess it, not a good reason to doubt yourself. So one thing that you might be using right now to doubt yourself is if there's a religious motivation for you. So you may believe that you have to be repentant, so you have to be a perfect, faithful follower of your God. And one of the things that may lead you to do is to think that you have to find every bad thing you've ever done and ask for forgiveness, ask for repentance. And when you look at where that has taken you to the point where you are now suffering and just consumed with a search through your memories and wondering if this memory is true or not, could this have happened, and you've become sort of incapacitated by this, we know that this is OCD, right? This is not actual good faith. This is not a good way to be following your spiritual path. This is not a good way to be practicing your religion. This is something that is actually making you less able to practice. And that is really important to recognize. This idea of I need to search my memory and find everything, that is a mistaken belief. That is a mistaken OCD belief, because you don't have to go searching and checking your memories. That is a compulsion, and that is something that is leading you astray and leading you towards greater anxiety, and it's leading you to generate all kinds of what ifs in your mind, and we want you to stop doing that. Now, some of the other reasons you might come up with are, I've heard of these things happening in the news. So, in the Me Too era, there's accusers coming forward, right? And they come forward like 10 or 20 years later, and, all of a sudden someone is in the news and everybody knows that they did this horrible thing. And, what if I'm that one of those people who did something horrible? I don't remember doing it, but someone's going to come forward 5, 10, 20 years from now and tell me that I did this horrible thing. Now that is basically saying that it's possible I might have done something horrible. It's possible there might be something I don't remember. It's possible there's someone out there that I hurt and I don't recollect it for some reason. Blacking out or something like that, and then eventually they're going to come forward, and eventually I'm going to, realize what a horrible person I am, and it's finally going to be out. And so we want to debunk that too. It's possible is not a good reason to worry about something, right? Is it possible that you blacked out, you did something totally outside of your character, you hurt someone in some way, and they are just out there debating what to do about it, and 10 years down the road are going to come out and tell the world and everyone what this horrible thing you did? Is it possible? Yes, it's possible in the same way that anything is possible, right? That statement, anything is possible, is absolutely true, because pretty much anything is possible. And so possibility is not a good reason to worry about it. This person that you heard about in the news has nothing to do with you. OCD loves abstractions, generalizations, and applying these to yourself. But you are a specific person in a specific situation, in a specific context. This person in the news has no relevance to you. And this story that you read has no relevance to you. So we want to start to debunk the idea that if something's possible, you should worry about it. No. Don't worry about just because it's possible. Possible has to be also with real information, real evidence. Then, then something's happening in your life and you got to deal with it. But there's nothing happening in your life right now that you have to deal with. You're just worrying there might be something out there that you don't realize, and that is not a good way to live. That's an OCD thing. Okay, some of the other tricks that might be getting to you is thinking that because you have a thought, then that must mean something really did happen. And we want to debunk that too, because you are in a pattern of obsessional doubt where you're reviewing your memories and you're reviewing every situation you've ever been in where you could have done something bad, and then you're starting to imagine that you might have. And when you're in the world of obsessional doubt, you're generating a lot of thoughts, you're generating a lot of images, you're generating all of these doubts, all of these what ifs. And so that is actually something that is a part of OCD, right? If I'm having this thought, it doesn't mean, oh gosh, that must mean I did something or there is a memory there or something like that. It actually just means you are engaged in obsessional doubt and you are generating all of these imagined possibilities. OCD is very much a disorder with the imagination kind of running wild. And so once you're doubting yourself, you're going into your imagination, and all kinds of things can come into your mind and your imagination, all sorts of what-if scenarios. And so just having a thought, just having a doubt actually means nothing more than the fact that you have OCD, and that's what happens when you have OCD. Another thing that might be getting to you, another trick, I'm feeling guilty. Right? I'm searching my memories and I'm just feeling guilty about myself, and I'm walking around feeling guilty all the time. This guilty feeling must mean I did something wrong. And we want to debunk that as well, because emotions happen at the wrong time all the time for everybody. People can feel guilty for things when they didn't do anything wrong. People can feel ashamed of themselves when they should be feeling good about themselves. And so an emotion is not evidence of anything. And oftentimes with OCD, an emotion is actually a result of obsessional doubt going into your imagination, imagining yourself being a certain kind of person, worrying you might be a certain kind of person, imagining yourself doing things. And guess what happens when you imagine yourself doing things? You are in a virtual reality movie theater, and you're going to feel those feelings, right? When you go to the movies, those movies make you feel emotions by watching that. And that's what happens when you're in your imagination. You're going to feel emotions about yourself. And so you're putting yourself through a lot right now. You're imagining yourself doing bad things, and you're going to make yourself feel guilty, and that's part of OCD as well. In addition to the whole it's possible thing, which I kind of already reviewed, one thing that might also get you is, well, the consequences are so great if this is true, right? So we're talking about someone who's traumatized. We're talking about someone maybe being hurt by me. And so I've really got to figure out if this happened or not, because the consequences are so great. And honestly, guys, this is no different than the it's possible argument. Just like something being possible is not a good reason to actually think it's relevant to you, just because the consequences are greater doesn't mean you have more of a responsibility to do this endless searching through your mind and torture yourself. That's consequences and possibilities still require evidence, and you don't have evidence other than you keep checking and generating kind of internal experiences, but there's no evidence in the real world, and it's time to trust that again. All right, guys, so anyway, those are a bunch of those things that I just wanted to go through. I hope this is helpful. It's probably a lot for one video, but I thought with this topic, let me throw out a bunch of things that you all might be experiencing from the I-CBT perspective. And the goal really is to notice how when you have OCD, you're engaged in this obsessional doubt, and you're convinced that you should doubt yourself for some reason, and all those reasons we just went through are some of the reasons. But the reasons to doubt never include actual real-world evidence happening in the here and now, right now. So you've got lots of reasons in your head to do this, but the most important one with OCD is always absent, which is an actual real thing happening in my life telling me that I irrefutably did something wrong in the past, right? That is the only thing that's missing, and it is the most important thing. And so trusting yourself, again, is getting back to a place of realizing you can make judgment calls about yourself. Deep down, you know you're a good person, right? I mean, the fact that you're tortured about this possibility that you might have done something wrong in the past is information about yourself, right? That guilty feeling or that feeling bad, that is you saying, I'm a good person. I don't like bad things. And that's really good information about yourself to let in and start to get to know yourself again. I'm the sort of person that doesn't like bad things happening to people. That's really good information. Let that in. Know that about yourself. And then start to realize there's no evidence here, and I'm going to trust what I'm seeing, and I'm going to trust what I know. And that's the core issue that sometimes is required to deal with this false memory OCD. Realizing you don't have a reason to search your memories. There's nothing in the present telling you you're a bad person. There's nothing in the present telling you you did something wrong. And so stopping the checking, stopping the search. All right, guys. Well, I hope this has been helpful. And until next time, trust yourselves. Take care.